Hello, thank you for joining this class today. My name is Lindsay, and I'm one of the nurse educators at MLKCH. If you're watching this, you may have heart failure, or you may be caring for someone who does. This might be new for you, and you might have a lot of questions. Or maybe you've been living with heart failure for a while and just want to learn some new ways to take care of yourself. Heart failure can feel scary and overwhelming at first, but you are not alone. This class will help you learn simple ways to manage your condition, feel your best, and stay out of the hospital. By the end of this class, I hope you'll feel confident and hopeful. With your strength, your spirit, the support of your loved ones, and your MLKCH care team, you can take control of your health. First, we start with the healthy heart. Before we talk about heart failure, let's first learn about how a healthy heart works. Your heart is a very important organ in your body. It sits on the left side of your chest. Your heart is a strong muscle. Its job is to pump blood all throughout your body. The blood brings oxygen to your body and helps carry away waste. Look at the picture in this slide. I want you to think of your heart and lungs like a team that passes blood back and forth. The heart is the pump, and the lungs are where the blood gets its fresh oxygen. Here's the simplest way to picture it. The heart sends blood to the lungs, and the lungs add oxygen to the blood. Then the blood goes back to the heart, where the heart muscle then pumps it out to the rest of the body. And this repeats over and over, all day and night. A healthy heart beats about 60 to 100 times each minute. That's over 100,000 beats per day. The heart is the body's hardest working muscle, pumping about 2,000 gallons of blood around the body each day. That's enough to fill an 8 by 10-foot swimming pool. Because your heart works so hard, it's important to take care of it. You can do this by staying active, eating healthy foods, managing stress, and avoiding harmful things like smoking. Now that we know how a healthy heart works, let's talk about heart failure. Did you know that 1 in 4 people will develop heart failure in their lifetime? That means even if you don't have heart failure yourself, you probably know someone who does. Heart failure does not mean that your heart has stopped working. It means your heart is not pumping enough blood to give your body the oxygen it needs. To put it simply, the heart muscle is weak or tired, and it can't keep up with all the work it needs to do. Remember, your heart works very hard every day to move a large amount of blood through your body. When the heart gets weak, it can't push that blood forward like it should. So what happens to the blood? It starts to back up. First, it backs up in the heart. Then it can move into the lungs and later into other parts of the body like your belly or your legs. And this can make it hard to breathe and can cause swelling. Your heart has to work harder to push the blood forward, but it doesn't have the strength it needs. That is what it means to have heart failure. Heart failure can affect the right side of your heart, the left side, or both sides. Sometimes the heart muscle becomes thick and stiff, like in the heart on the left side of this picture. This is called hypertrophic. When the heart is stiff, it has a hard time relaxing and filling up with blood. If it doesn't fill well, it can't pump out as much blood. Other times, the heart muscle becomes stretched out and thin, like in the heart on the right of the picture. This is called dilated. When the heart muscle is too thin, it becomes weak and it doesn't have the strength to pump as well. So, the heart can have trouble pumping because it is too stiff or because it's too weak. Do you know what type of heart failure you have? Is it on the right side, the left side, or both? Is your heart muscle stiff or is it weak and stretched? If you're not sure, that's okay. It's just a great question to ask your doctor. Your type of heart failure helps your doctor choose the best treatment plan for you. Everyone's heart is a little different, and your care should match your body's needs. You might be wondering, what causes heart failure? Heart failure is often caused by damage or injury to your heart. This damage can be caused by other heart problems like a heart attack, high blood pressure, or a dysrhythmia like AFib. It can also be due to heart defects that are present at birth, or be caused by pregnancy. Infections such as COVID-19 or HIV can be a cause, and so can kidney disease and diabetes. There are even some medications, such as chemotherapy meds, that can cause heart failure. And risky lifestyle choices, such as smoking, eating too much unhealthy food, and alcohol and/or drug use are all risk factors as well. These health problems can put stress on your heart over time, and this wear and tear can make your heart muscle weak and lead to heart failure. If you have more than one of these conditions, your risk is even higher. So, if you see something on this slide that sounds like you, please know you are not alone. Many people listening to this class are going through the same thing. Signs and symptoms of heart failure. What do I mean when I talk about signs and symptoms? Signs and symptoms are clues that your body gives you to show you how it's feeling. Symptoms are things that only you can feel. For example, when you have a headache or when you feel dizzy. Other people can't tell by looking at you, so we have to ask you questions about your symptoms. Signs are things that other people can see. For example, a rash or a cough. Heart failure can look different for each person, and it depends on how serious your heart failure is and which side of your heart is affected. You may notice any of the following signs and symptoms. Trouble breathing. Often this is after activity, but as the disease gets worse, the shortness of breath can be at rest as well. You may have difficulty breathing when you lay down at night to sleep. You may also have trouble sleeping due to a cough. The cough might be dry, or you might cough up some frothy mucus. You might experience chest pain. You might feel really tired, like you have no energy to do anything. Your heart might feel like it's beating fast or uneven. And you might notice swelling in your ankles, your legs, or your tummy. Maybe your fingers and toes are colder than the rest of your body. And maybe you've noticed a purple color around your nails, or even more concerning, around your mouth. Next, we will look at a color-coded chart. This chart will help you know when to call your doctor and when to go to the emergency room, based on your signs and symptoms. This is a 3-color chart to help you understand how well you're managing your heart failure. You can find this chart in your heart disease guide and look back at it at any time. Think of it like a stoplight: green, yellow, red. First, let's look at the green zone. The green zone means you are doing well. You can breathe easily, you can do your normal activities, you don't have any swelling or chest pain, green means go. Keep doing what you're doing. However, if you notice something starting to change, like maybe you're gaining weight, having difficulty breathing, maybe you notice swelling or you develop a cough, now you're in the yellow zone. The yellow zone means slow down. Call your doctor. The yellow zone tells your doctor that you may need a change in your medicine, or you might need to focus more on your own healthy habits. The red zone means stop, go to the emergency room, or call 911. So, if you can't catch your breath even when you're resting, if you have chest pain that doesn't go away with medicine, or if you're feeling dizzy and confused, it's time to get help right away. Okay, it's time for some real talk. Heart failure isn't an illness that goes away or that you get better from. It's chronic, meaning once you have it for life. It's also progressive, which means if you don't take the steps to make healthy changes now, your condition could get worse. I don't say this to scare you. I say it to motivate you. A heart failure diagnosis doesn't mean your heart has stopped working altogether. Take a moment. Put your hand on your chest. Close your eyes. Take a deep breath in and out. Do you feel your heart beating? That's your life source. Take a moment to say thank you to your heart for all that it does for you. Your heart is working so hard for you. What changes can you make to benefit your heart? Now we're going to talk about how to manage your heart failure after you leave the hospital. So listen carefully, take notes if you want to, because these are all the tricks and tips that we can offer you to help you feel your best and prevent you from ending up back in the hospital. There are 8 important steps to health and success with heart failure. They include weighing yourself daily, monitoring your fluid intake, taking your heart rate and blood pressure twice a day, eating a heart-healthy diet, which includes staying away from salt, managing your other health conditions, getting movement, refraining from smoking, drinking, using drugs, and finally, taking your medications correctly. All of these steps can be found in your heart disease guide, so you can look in your booklet if you ever forget what the 8 steps are. Now let's talk a little more in depth about each one. Step 1. Become best friends with your scale. This is just a funny way of saying weigh yourself every day. One of the most important things you can do to keep yourself healthy is to weigh yourself every day and write down your results. Why do we ask you to weigh yourself every day? Well, your scale is like a smoke detector for heart failure. It can warn your doctor about fluid buildup before you start feeling really sick. A weight that is going up is one of the earliest and easiest ways to tell if fluid is building up. If your heart failure is causing fluid to build up, you will gain weight. To get a good weight, you should weigh yourself in the morning after using the restroom but before eating or drinking anything. Always use the same scale and put it in the same spot. Either wear no clothes or wear the same clothes every day during your weigh-in, and do not wear shoes. And like I said, but I'm going to repeat it because it's so important, write your weight down, either in your heart failure book or in a journal of your choice. It's important to write it down because we want to compare your weight today to your weight from yesterday. Small changes in weight can indicate a big problem. If you gain 2 pounds in one day or 4 pounds in 1 week, you're in the yellow zone, and that means call your doctor. Sudden weight gain is written on the color-coded chart in your booklet as one of the concerning yellow zone signs. Remember, weight gain doesn't mean you're getting fatter. It means your heart is struggling and fluid is starting to build up in your body. That fluid can make you feel swollen or have trouble breathing. When fluid builds up in your body, it makes you gain weight. Think about it. If you gain 4 pounds in 1 week, that's like strapping a 2-liter bottle of soda to your chest. Think of how heavy that is and how much extra fluid that is to carry around. So again, if you gain 2 pounds in 1 day or 4 pounds in 1 week, you're in the yellow zone, and that means call your doctor. We want to catch problems early before you end up back in the hospital. Do you recognize the big MLKCH measuring cup on this slide? Did your doctor or your nurse explain to you why we give you this cup? We give it to you to help you measure your fluid intake. Your doctor will ask you to limit your fluids in order to reduce fluid buildup in the lungs and body and to prevent overloading and overworking your heart. To put it simply, we reduce your fluid intake to prevent swelling and difficulty breathing. Remember, every case of heart failure is unique, so every treatment plan will be unique. Your doctor will tell you how much fluid you're allowed to have daily, and it will most likely be between 1,200 to 1,500 milliliters of fluid a day. Do you know how much fluid you're allowed to have in one day when you leave the hospital? If you don't know, please ask your medical team. Remember, when measuring your liquids, you must include all the liquids you consume in a day, not just water. On this slide, there's a list of liquids: water, coffee, tea, milk, juice, soda. That all probably makes sense. But there are a few surprising food-like items that are also considered liquids. For example, soup, fruit smoothies, jello, ice cream, popsicles, sorbet, and even ice. The best way to keep track of your fluids is by keeping a daily log. Write down every liquid you eat or drink, the amount you took in, and keep adding the amounts together to keep a running total. For example, this patient is allowed 1,500 milliliters of fluid a day. For breakfast, they measured both their coffee and their milk, and they remembered to include the soup, the smoothie, and the ice cream that they ate when keeping track of their fluids. They kept their fluids within 1,500 milliliters, so this is a successful day of managing fluid intake. Measuring your fluids can be tricky because sometimes fluids are measured in different units, like ounces. Here on this slide is a conversion chart, and it's in your book as well, under the fluid restrictions section. Or if you have a smartphone or a computer, you can always go to a web browser and search for a unit converter. You'll want to convert all your fluids to milliliters or cups. As you can see on the conversion chart, 1,500 milliliters is the same as 6 cups. So another easy way to monitor your fluid intake is to limit yourself to 2 cups of fluid from breakfast to lunch, 2 cups from lunch to dinner, and 2 cups from dinner to bedtime. Remember though, this doesn't mean 6 huge glasses of fluid. No, The cups you use should be no more than 8 ounces in size. If you want some tricks and tips to reduce your fluid intake, try making these small changes. Use a smaller cup. The smaller the cup, the fuller the cup looks, and your brain will be tricked into feeling like it's getting more. Try swallowing your pills with food, like yogurt or applesauce, so that you don't waste your fluid allowance on taking your pills. And sip your fluid slowly. When you're thirsty, it's normal to want to chug your beverage, but drinking slowly promotes hydration and absorption, so it will actually make you feel less thirsty in the long run if you drink slowly. When you do feel thirsty, try snacking on a frozen grape, a frozen orange slice, or any piece of frozen or cold fruit. Brush your teeth often. Suck on a hard candy or chew your favorite flavor of gum. And of course, always keep your chapstick handy to soothe dry lips. Okay, time for a little knowledge check. Can you name a dessert that counts as a fluid? Now, we talked about this a little bit in the fluid restriction section. We were talking about foods that count as fluids. And there are multiple answers to this question, but I'm just looking for one. So think if you can name one dessert that counts as a fluid. Okay, got the answer in your head? The answer is, or I guess the possible answers are ice cream, sorbet, popsicles, smoothies, or jello. They would all be acceptable answers to the question, can you name a dessert that counts as a fluid? Good job. Now we've talked about using your scale and we've talked about using your measuring cup. The third item that you need to be familiar with is a blood pressure monitor. It's important to check your heart rate and blood pressure twice a day, every day, because a heart that is beating too fast or a blood pressure that is too high can make your heart failure worse. Do you know what your normal heart rate and blood pressure readings are? If not, that's another good question for your doctor or care team. There's a spot to write down your heart rate and blood pressure goals inside your heart disease guide on the My Blood Pressure, Heart Rate, and Weight Log page. You have to know your normal so that you can tell when your readings are going up or going down. You should take your heart rate and blood pressure every morning after going to the bathroom, but before eating or drinking. So if it were me, I'd get in the habit of doing my weight and then my blood pressure, pairing them together just to make it easier to remember. Sit in a chair with good back support, with your legs uncrossed and your feet flat on the floor. Put the cuff on, making sure it is directly on your skin and not over your clothing. Rest your arm on a flat surface so that your upper arm is at the level of your heart. Sit quietly for 5 minutes and do not talk until after you get your readings. After 5 minutes of sitting and relaxing in silence, press start on the blood pressure monitor. Once the cuff deflates and you have your heart rate and your blood pressure readings, write down your results in your booklet or in a journal of your choice. You'll do this whole process again in the evening before bed. Posture is so important to getting an accurate blood pressure reading. Let's look at these 4 photos on the right and figure out what's wrong with their positioning. What do you think is wrong with the photo on the top left? In this photo, the patient's arm is bent and it isn't resting gently. What's wrong in the photo on the top right? Well, in this one, the patient is sitting with her legs crossed and her feet are not flat on the floor. In the photo on the bottom left, the patient's arm is hanging down. Again, it's not resting gently at the level of the heart. And finally, in the last photo, the cuff is on over the patient's sleeve instead of directly on his skin. Now let's look at the drawing on the left. This patient has the perfect position. His feet are flat on the floor, his back is supported, his arm is resting gently at the level of his heart, his cuff is on correctly against his skin, and he isn't talking. This is what to aim for every single time you use your blood pressure machine in order to get the most accurate readings. Step 4 of managing your heart failure is to stick to a heart-healthy diet. Now, when it comes to adopting a heart-healthy diet, you have options. There isn't just one way to do it. And you don't have to change your whole diet overnight. Try making one small change at a time and focus on adding healthy foods rather than restricting yourself. Think about finding balance in your diet. Most heart-healthy diets emphasize eating fruits, vegetables, nuts, legumes like chickpeas or beans, whole grains like brown rice, lean animal protein like skinless chicken breasts or eggs, and fish. Heart-healthy diets ask you to stay away from eating foods high in saturated fats, red meat like beef, pork, veal, and lamb, processed meats like pepperoni, hot dogs, and deli meats, refined carbohydrates like white bread or baked goods, and of course soda and other sweetened drinks. One of the most important things your doctor is going to want you to cut back on in your diet is salt. This is a tough one for most people because salt is in so many of the things we eat and we get a little addicted to the flavor. But your doctor has a reason for their request. You see, salt can act as a sponge in your body, holding in fluid, and that fluid can build up around your heart and lungs, making it harder to breathe. And it can also cause you to feel swollen. Salt can also make your blood pressure higher, which can cause even more damage to your heart muscle. And remember, you're limited on fluids and salt makes you thirsty, so we want to prevent that. Another word for salt that you're likely to come across is sodium. 1 teaspoon of salt is 2,300 milligrams of sodium. Your doctor is going to ask you to limit all the salt you eat in a whole day to about 2,000 milligrams of sodium, so less than 1 teaspoon. Now, you might be thinking, that's fine. I don't use salt. I won't add any salt to my food. Well, it's a little trickier than that. Salt or sodium doesn't just come from obvious sources like chips or pretzels, or even your salt shaker. It's often found in everyday foods. That's why it's important to look at nutrition labels to see how many milligrams of sodium are listed. If you eat 3 meals a day with a couple of small snacks in between, you're going to want to limit the sodium in each full-size meal to about 400 to 500 milligrams. Can you find sodium highlighted on this nutrition label? Notice that there are 700 milligrams of sodium in 1 serving. How much is 1 serving? Well, to figure that out, we always have to remember to look at the serving size as well, because it's often not the whole box or the whole can. See on this label how there are 6 servings in the container? That means you would need to divide the box or can into 6 portions, And 700 milligrams of sodium are in just one of those 6 portions. 700 milligrams is too high. We want the sodium to be 500 milligrams per meal or less. As you can see from this label, pre-prepared foods are full of sodium, and often the healthier option is to prepare fresh foods for your meals. Here on this slide are some common foods that are loaded with salt, and next to them are smarter options to swap with. So, for example, canned soups are full of sodium, so try using the low sodium option and then add extra flavor with herbs and spices. Or better yet, make your own soup from fresh ingredients. Or instead of deli meats, try fresh roasted chicken or turkey, which doesn't have all the preservatives and they're lower in sodium. You can always refer to the Heart Disease Guide if you want to review high sodium foods and their alternatives. When eating out at a restaurant, it's okay to ask to see the Nutrition Facts Guide so that you can see how much sodium is in the food they offer and you can make an informed decision. If you have trouble getting your hands on healthy food, please let your provider know so that we can provide you with resources. Here are some tips to help you reduce your salt intake. First, cut back slowly over time. Don't try to eliminate all your salt intake at once. You might get discouraged and give up, whereas if you start slowly and build up over time, you're more likely to succeed. Start with one meal. Add on a second once you get comfortable with that first one, and so on and so on. Next, limit the salt you use, so don't add any salt from the shaker onto your food. And if you're cooking, try using half the amount of salt called for in the recipe. Instant foods are loaded with sodium, so avoid them whenever possible. Same with condiments like salad dressing and ketchup. When you're shopping, choose sodium-free or no salt added, or light, reduced, low, or even very low sodium foods. And finally, get adventurous with herbs and spices. Try using them to add flavor to your food instead of salt. For example, I like to add a little garlic powder to my French fries to replace salt. But be careful that it's garlic powder, not garlic salt. And be sure to ask your doctor first if garlic powder is okay to eat or if it interacts with any of your medications. Ginger, turmeric, cinnamon, and cayenne pepper are all examples of heart-healthy herbs and spices that you can use. Step 5 of managing your heart failure is to stay in control of your other health conditions. Many of us watching today are probably living with multiple health conditions, not just heart failure. Maybe you have high blood pressure, diabetes, kidney disease, COPD. Managing those conditions, like taking your medicines on time, eating the proper diet, keeping up with your dialysis, these things will result in fewer heart failure symptoms and improve your quality of life. It's also important to get all your vaccines, especially flu and pneumonia vaccines, because those illnesses can make patients living with heart failure very sick. Regular exercise has many benefits for patients with heart failure, so let's look at step 6 of managing your heart failure. Get up and get moving. Regular exercise can strengthen your heart and your lungs while improving blood flow. Good blood flow is how oxygen gets spread out around the body. While exercise may feel more challenging when you have heart failure, over time and with commitment, it can actually help increase energy levels so you can do more activities without becoming tired and out of breath. And of course, exercise improves muscle tone, strength, balance, and joint flexibility. most important part of your exercise plan is to follow your doctor's recommendations. Most likely, your doctor will recommend gentle exercises like walking, seated stretches, strengthening exercises, or swimming. Wear well-fitting, comfortable clothes and be active for a total of 30 minutes a day. But if you need to, you can break that up into smaller chunks of time that add up to a total of 30 minutes. For example, maybe in the morning you walk for 10 minutes, then in the afternoon you do some seated stretches for 10 minutes, and then before bed you do a deep cleaning of your house for 10 minutes. There you go, you've hit your 30-minute minimum. Maybe there's a medical reason why you can't get out of the chair or out of the bed. That's okay. Try using water bottles as weights and doing seated arm and leg exercises. Look, the point isn't to be an athlete. The point is just to gently elevate your heart rate. You'll want to add activity to your day a minimum of 3 to 4 days a week, and we want you to build up to a goal of 5 to 6 days a week. Don't forget to include a warm-up and a cool-down before and after your exercise of choice. Resting when needed is recommended, but do not lay down after exercising because it will make recovery more difficult. Remember, stop and call your doctor right away if you experience chest pain, dizziness or faintness, stomach sickness, or shortness of breath. Step 7 is let go of the habits that no longer serve you. I don't like the saying bad habit. I don't want you to get in the mindset that you have a bad habit, because then you start thinking of yourself as a bad person, and you're not a bad person. You're a good person with some unhealthy habits that no longer serve you. And I want you to walk away from this presentation today knowing that if you seek to make a change, it's never too late to stop, and it's always okay to ask for help. Let's talk quickly about why these unhealthy habits can actually worsen your heart failure and your symptoms. First, smoking. Smoking worsens your heart failure in 3 ways. First, it raises your blood pressure. This increases the workload on your already overworked heart. Second, the chemicals in the tobacco decrease the amount of oxygen in the blood, which then decreases the amount of oxygen in your tissues and even to the heart muscle itself. And third, it causes physical damage to your lungs, which makes breathing even more difficult than it already is. Heavy alcohol use also raises blood pressure. It can cause irregular heart rhythms, or it could cause malformations of the heart that can worsen your diagnosis. And finally, recreational drug use. Drugs can do damage to the heart and blood vessels. They can cause the heart to beat irregularly, or they can cause the heart to stop beating altogether. There is also a potential risk of infection to the lining of the heart, and all of these things cause stress to the heart muscle, and they make your heart failure even more severe. So remember, it's never too late to stop, and we do have resources to help you if you're interested. Step 8, take your medications correctly. Medication management in heart failure is like keeping an orchestra in tune. Each medication plays a different instrument, and when they play together correctly, it's music to our ears. The heart works more smoothly, symptoms improve, and patients stay out of the hospital. But when medications are missed or taken incorrectly, the music sounds out of tune. Taking your medications correctly can help you stay out of the hospital and to feel your best. It can also help you to breathe more easily, have less swelling, and have more energy. Certain combinations of medications have been proven to help you live longer when taken together as prescribed. It is very important to take your medicines on time every single day. If you cannot afford or have trouble taking your medicines, talk to your healthcare provider. Do not stop taking your medicine even if you start to feel better. When you take your medicine, you want to pay attention to these three things: to time, dose, and special instructions. For time, maybe you're supposed to take your medications in the morning, or maybe you need to take your medications 3 times a day. The special instructions might say something like, take this medication with food, or do not drive when taking this medication. You want to pay attention to the prescribed time or times and take your meds at the same time every day. Be sure to discuss new medications with your pharmacist. Most people with heart failure require several medications a day for best results. And if you're taking medicines for any other chronic illness, it can get overwhelming trying to keep track of so many pills. That's why we've provided you with a medicine chart inside the Heart Disease Guide. Let's practice filling it out together. Let's say you just got a prescription for metoprolol, which is a medication commonly given to heart failure patients. Now, using a pencil so that you can easily make changes when you need to, let's fill out this medicine chart together. The name of the medication is metoprolol. And what is this medication for? It's always important to ask, why am I taking this medication? What does it do? If you don't know the answer to that question, you should ask your care provider, your nurse, your pharmacist, someone part of your care team. So what does metoprolol do? Well, metoprolol helps slow down your heart rate and lower your blood pressure. What is the dose that the doctor has prescribed? The dose is 25 milligrams. And how often are we taking this medication? Well, the prescription says twice a day. What time is the medication prescribed for? Morning and evening, right. And are there any special instructions with this med? Yes. The prescription says take with food. Finally, what is the refill date for this prescription? The refill is April 4th. Why do you think it's important for us to know the refill date? Well, because we don't want you to miss even one day of medication. In this way, we can track when we're getting close to our refill and we can pick it up on time and we don't have to miss a single day of meds. And a week before you run out of medicine, you should be thinking about picking up your refill. And don't forget to bring this list with you to all of your doctor's appointments. You may even want to carry a smaller copy in your wallet or your purse, or take a photo of the completed list with your phone. And speaking of phones, here's one final tip to help you remember to take your meds at the correct time. You should set an alarm on your phone or your watch as a reminder. Okay, you've made it through the 8 steps. Congratulations. You now have all the tools you need to succeed. There is one more tool though, and that is follow-up care. I can't stress enough the importance of follow-up care. Leaving the hospital is step 1, but follow-up care helps prevent you from ending up back in the hospital. Follow-up care is beneficial in 4 ways. First, the doctor can make sure you're getting better. Second, if needed, the doctor can make adjustments to your medications. Third, if there are problems, the doctor can catch them early and prevent you from ending up in the hospital again. And last, the doctor can reinforce the education you learned, the stuff you're learning here in the class. They can remind you, maybe give you some more tips and tricks on how to succeed. Early follow-up is one of the most effective ways to keep you healthy and home. So please let your provider know if you have difficulty getting to your follow-up appointments so that we can provide you with resources to help. So let's put all the information I've given you today together. First, your heart failure is manageable. Second, your actions, such as altering your diet, giving up unhealthy behaviors, and going to follow-up care appointments, can all prevent complications. And third, with all the resources and support available to you, you don't have to go through this alone. Heart failure, yes, it is a lifelong disease, but you can do your best to prevent it from getting worse. Use all your tools, your measuring cup, your scale, your blood pressure machine, your booklet, the MLKCH heart disease webpage, as well as the support of your family, your friends, and your healthcare providers to make the necessary changes to keep yourself out of the hospital and out enjoying life with strength, spirit, and support. You can thrive despite your diagnosis. And that brings our presentation to a close. Thank you so much for your time and attention during this class. I really hope you're taking some useful knowledge away with you today. And on behalf of myself and MLKCH, I want to wish you and your loved ones nothing but health and happiness. Thank you so much again for your time and attention. Have a great day.